Hospitals in America are legally killing people by the thousands every single day. I'm going to teach you what you need to do to prevent you or a loved one from dying negligently in one of these hospitals. I've received over 1,000 messages in the last 24 hours of patient horror stories for them or their family members of what hospital negligence has done and all the deaths that I have encountered in my medical career seeing this happen. First and foremost, if you leave an elderly individual in the hospital alone, you should be in prison for elder abuse. Why? It's the equivalent of leaving a 6-month-old baby alone at home without anyone there. Nobody would ever do that. But you're doing the same thing to an elderly individual because that hospital, if you have no patient advocate, that hospital is going to do whatever they want and nobody's going to stop them. All right. So first thing, when you get into the hospital, the first thing they try to push on you is a pneumovax and a flu shot. Why would I want to put these heavy metals in my body? Now, I can't list the names because they're going to go put the red fact check information on this post that I don't want, but do your own research. Why would I want to put something in to suppress my immune system when I'm already sick? I didn't come here for that purpose. I came here to fix my illness, not to receive 2 other shots. That's first and foremost. Secondly, one of the most common medications they give everyone in these hospitals are antacids or PPIs, proton pump inhibitors. What they end up doing is they impair nutrient and mineral absorption. So now you're not absorbing magnesium, you're not absorbing selenium and the trace minerals. Well, you can't have proper cellular function and you're going to have more side effects when you're not absorbing nutrients, which they're not even providing you. They will never provide you with a nutrient IV there. Well, one big thing is this heparin. So they give everybody heparin shots 3 times a day. Heparin's a blood thinner. And I was discussing with a nurse, why are you giving this patient heparin 3 times a day when they're getting up, walking, they're eating, they're going to the bathroom, and they're going to sleep in this bed? Don't you do the same thing at home? Would you give yourself a heparin injection at home every night? They say, no, I wouldn't. So why are you doing it to the patients, causing more harm? Okay, the patients can't sleep. Every 2 hours, they get interrupted all the time by nursing staff, by beeping machines. Well, over a period of time, with that patient's not seeing the sun, they're not going outside, they're stuck in a room with artificial light, they're going to go into a psychosis. And they're not sleeping. And their cortisol level is going to shoot up. Their immune system is going to be even more suppressed. No one thinks or has the brain capacity to say, let's let this patient sleep for 8 hours so they can get a great night and feel better tomorrow. No, it doesn't exist in a hospital. So the longer you are there, the higher your chances of morbidity and mortality, which is equivalent to death. So now that you're in a psychosis, because you haven't slept in a week, they want to put you on psych meds. Geniuses, right? Instead of letting you sleep in a room for 8 hours. Okay. And then if you end up getting, contracting a small infection, instead of pinpointing what antibiotic they should give you, they'll throw an AK-47 of vancomycin and zosyn, which is very broad spectrum. The problem is this kills off your gut microbiome. And we know through studies that killing off the gut microbiome will lead to severe anxiety and depression, which also suppresses your immune system, which makes you more susceptible to having repeat infections and having superimposed infections, and then contracting things like hospital-acquired pneumonia or a hospital-acquired urinary tract infection. So they don't really think about what the consequences are of what they're doing. I asked a nurse in a hospital when I was being a patient advocate for somebody, hey, have you checked this patient's vitamin D3 levels? They have malabsorption issues. No, we don't do that. Well, don't you think it's beneficial to give that patient a shot of vitamin D3 when they're in the hospital, get their levels above 60? There's published studies showing there's reduction in morbidity and mortality. There is a decreased stay in the ICU when patients have optimal vitamin D3 levels. But something that costs them $2 to give you a shot of vitamin D3, they refuse to do. Then you'll talk to them, can you give the patient magnesium for proper cellular function? Oh no, we don't do that. The magnesium levels are normal. Well, yes, because you're not testing red blood cell magnesium, you're not testing the right type, you're not doing the labs correctly to understand. Anyone can receive magnesium as long as they have proper kidney function. You can give it to anyone in high doses and they're going to do absolutely great and it's going to help them. Hey, can you give this patient glutathione with an infection? Oh no, we don't know what that is. Oh, you don't know what the master antioxidant of the body is. So you're willing to pump in thousands of dollars of antibiotics for your own profit, but you won't help that patient receive a glutathione infusion in the hospital. Makes sense. Then you ask them something about vitamin C. Hey, can you give this patient high-dose IV vitamin C? They have a severe infection. You can see the published studies showing that there's increased efficacy of providing IV vitamin C when patients have a bacterial infection. Oh no, sorry, we don't do that. The bottle of vitamin C costs $50. They refuse to spend $50 to get you out of that hospital because they don't want to give you that medication. So I've received thousands of stories. Please share your story below. I know this video is long, but it's very informative, and you have to advocate for your patient. You cannot leave anybody alone in a hospital. You have no idea what they're capable of doing. You have to watch them like a hawk. They will slip something in without even knowing or explaining it. And guess what? They have zero liability. You can't do anything about it. Imagine you're a prisoner in jail and you're being assaulted by another prisoner. What are you going to do? Call the police? They're not going to do anything. It's the same thing in a hospital. There's nothing you can do other than advocate and fight for your patient. And I urge everybody to do so. Thank you for listening. Drop your horror story from the hospital below.